U.S., you can't treat cancer unless you're an MD, and that's a problem. To the profession that does not even know how to cure heartburn, we have given $600 billion to come up with a cure for cancer. Gee, I wonder why we aren't any closer to a cure for cancer than we were when Richard Nixon declared a war on cancer, right? 97% of the time, chemotherapy doesn't work. It doesn't work. So if the MD medical community is all about research and double-blind this and double-blind that and, you know, let's prove it, why is chemotherapy still being rolled out? Because it's been proven to be ineffective, doesn't work. So why on earth do they do it? Because it's a gigantic moneymaker. It's gigantic money. It's gigantic money. And it's a problem because, you know, we don't have a free medical market. And when you're the king, you can do whatever you want. And so cancer treatment fails, cancer treatment fails, cancer treatment fails, cancer treatment fails, cancer treatment fails. And we keep going back to the MDs because we don't have any other option. And quite frankly, when you've been pinned with a definitive diagnosis of cancer, you're afraid for your life.
Yep.
Your medical doctor could tell you to jump off the roof of the hospital, and it's going to part of the treatment, and most people would do it. And it's a problem. And also, because the medical industry is an industry, right, and it's involved with money and finances and profit, most of the time the oncologist doesn't inform the patient 100% about what's going to happen. They tell the patient what to do. They don't have a conversation with the patient about what they're going to do. They order the patient, well, sorry, Mr. Smith, you've come back with a definitive diagnosis of prostate cancer. I have you scheduled for surgery on Wednesday. You're lucky there was an opening. And then we're going to start you on chemotherapy a week later. Go see the nurse and she'll schedule it. They don't have a conversation. The oncologist knows what side effect it's going to create. The oncologist knows everything. But the oncologist also is of the belief, the fundamental philosophical belief, that you are screwed. You've got cancer, Jack, and there ain't no going back. So even though this therapy is only 0.1% successful, you better just shut up and take your medicine because there's nothing else for you to do. What are you going to do, a coffee enema? There's nothing else for you to do. So I know it's not a perfect world. I know it's not a perfect therapy, but it's all we've got, and you just need to do it because I'm the doctor and I said so.